My name is Jennifer McComis. I'm the director of the Pulmonary Service Line here at King's Daughters. I've been here for 26 years working in all areas of respiratory care. I'm excited to highlight the team and all that they do to provide quality care for our patients. We specialize in the care of pulmonary disease, lung disease. The cardiopulmonary system is something that all respiratory therapists specialize in, and they're all over the hospital. So if you've been in the hospital or you've been in the ICU, the emergency room, you've been short of breath and sought treatment at King's Daughters, you've probably been touched by a respiratory therapist in some way. With respiratory care, we take care of all lung diseases. The major one that everyone's most familiar with is COPD. We have a COPD Navigator program in the Lung Center. The Lung Center is the outpatient clinic. We have diagnostics there to test you for lung disease. We do bronchoscopes, we do all kinds of procedures to diagnose and treat lung disease, take care of people with lung nodules in the Lung Center. We have a navigator to help navigate those in partnership with the oncology department. We have sleep medicine center. We do diagnostics in a specialty clinic for people who have any issues with sleep. We also have pulmonary rehab. So pulmonary rehab is for patients who have chronic disease. We help them increase their quality of life by doing medically supervised exercise and education to help them lead the best possible life they can while living with lung disease. I'm excited to celebrate the respiratory therapists and all that they do to take care of our patients. They're the frontline people that are right there with all of the other healthcare team when patients can't breathe, when they're in a very dire situation. On the inpatient side, they're the first one at the bedside to help with that. So it's a stressful job, but it's a rewarding job because of all that they get to see accomplished for their patients. On the outpatient side, they get the privilege of having patients come in with very scary things happening to them and help them understand what's happening and help them with their treatments and to get what they need to take care of themselves and their family members. COVID was, of course, as everyone knows, crazy and unexpected, and nobody knew what was happening from day to day to hour. So those respiratory therapists were the ones trying to manage those ventilators and maintain those airways and help people breathe. So it has been a very interesting year for the respiratory therapist, as for the entire healthcare team, but I am very proud of all that they accomplished and the numbers that we have seen in our facility because of the hard work that they do.